important time.
Linus, are you here with us? You are muted.
Oh, sorry. I thought I'd muted myself. Thank you very much, Pendo, for the very warm welcome. As you've heard, my name is Linus Oyugi. I am a hospital psychologist based at the Upper Hill branch, and I'm honored to have the opportunity to be the one facilitating or moderating this conversation. As you know, yesterday, the 19th of November, the world marked International Men's Day. And this morning, as a new day begins, we choose not to let the conversation end, but to carry it forward with purpose and clarity. A warm welcome to today's topic, which is unmasking strength and having real conversations on men, mind, and meaning. In our communities, far too many men continue to suffer in silence. Depression is often minimized as just pressure. Suicide is recorded as an accident, and chronic stress is mistaken for commendable hustle. The result is a silent toll measured in fathers, sons, brothers, and friends lost before their time is due. This morning is not about blame. It is about gently and firmly removing the masks that boys are handed from childhood and redefining what strengths truly mean when it makes room for honesty, help seeking, and human connection. Today, we'll address essential questions. First of all, what does it cost a man and those who love him when he learns to never reveal his vulnerability? Why do we honor a man's ability to provide materially, yet question his courage when he says, I am not okay? And most importantly, how do we raise the next generation of boys to understand that genuine strength includes the capacity to feel, to speak, and to ask for support? It is my privilege to introduce our distinguished panel, each of whom combines professional expertise with a deep personal commitment to his work. Mr. Patrick Nyagudi, who's a hospital psychologist in charge at Chiromo Hospital Group, Dr. Joseph Nyamiobo, a consultant psychiatrist at Chiromo Hospital Group, and Dr. Chibanzi Mwachonda, who is also a psychiatrist and a labor expert, and last but not least, Dr. Mutiso, a consultant psychiatrist at Gilead Mental Health Consultants. Gentlemen, thank you for bringing both your knowledge and your courage to this platform. To every man present or watching this morning, this is a safe and respectful space. Your experience matters. Your struggles are real, and choosing to address them is one of the most responsible acts a man can perform. Let us now begin our conversation that is timely and long overdue. So we'll head straight to our questions, and I was hoping we could start with a warm-up question. Well, I'll allow each of the panelists about 30 seconds to say, what does International Men's Day personally mean to you in the context of mental health? We'll start with you, Patrick. What does International Men's Day personally mean to you in the context of mental health? Patrick, go ahead.
Thank you very much, Linus, and to all members present, karibuni sana. So what International Men's Day means to me is that I'm cared for. As simple as that.
That you're cared for.
Yes.
Thank you, Mr. Patrick. Dr. Joseph, what does International Men's Day to you personally in the context of mental health?
Thank you very much, Linus. To me personally, it means that I would like to be celebrated and to celebrate each other, every other man, either a male man or a boy, to also discuss about social, emotional, and physical and spiritual health in the context of mental health.
Thank you very much, Dr. Joseph. Dr. Chibanzi?
Thank you. For me, it means that we have an opportunity to create a world where men feel empowered and to prioritize their mental well-being and live healthier, fuller lives, and to raise awareness about the issues surrounding men's mental health, and also educate men and break the stereotypes for men in regards to their mental well-being.
Raising awareness and breaking the stereotypes. Thank you very much, Dr. Chibanzi. I don't know if Dr. Mutiso has already joined us. Are you able to hear me, Dr. Mutiso? I'm being informed Dr. Mutiso is not yet in, so we'll just proceed. Hopefully he'll join us any moment now. So we'll go to a very fast question, and I'm going to put you, Patrick, on the spot for the very first question, which is, why do you think so many men struggle with identifying and expressing emotions? Do you think that men come out of the box that way, that they are wired in that manner, or what role do you think the society plays in hindering men from identifying and expressing their emotions, and what practical steps do you think men can take to help them develop emotional literacy?
Okay, thank you so much, Linus. Men are not boxed just like that they are not able to express their emotions, but this is a societal construct that a man should. So there are so many conditions that a boy child is given from as early as when they are young. So there's this social conditioning that you should man up. So I'm looking at an experience like a 4-year-old boy who has maybe fallen down, and the dad is like, you should not cry. You should not cry because you're a man. So what does this particular child grow up knowing? That if I'm hurt, I need not to express my heart. So we grow up as men knowing how to suppress our emotions. So this is taught from a very early age. And at the same time, men will equate their emotions to weakness. So this is a conversation that has come in handy, that we need to debunk this particular issue, that showing emotion is not weakness. Rather, it is part of our strength. Then the other thing that comes to play is a concept called alexithymia, whereby as men, they have this particular inability to recognize and describe their own emotions. So yes, they are feeling a particular emotion, but they can't really talk about it or name it. As compared to our female counterparts, they are able to describe the emotions in a full range, from mild to the extreme. So for men, it is either I am fine, I am okay, or I'm not okay. I think that is the farthest that most men will go. So when we are talking about alexithymia, we need to encourage the boy child and the men to have more vocabularies in terms of their emotions. The other thing that men struggle with, or make them a bit vulnerable to others, is the workplace and relationship pressure, whereby they feel like they need to be that stoic provider. So constantly provide, even if you're in pain, still provide, both at work and even at home. The other thing that also is a challenge for men is they lack vocabularies to describe what they are feeling. As I said earlier, it's very easy for a man to say that I'm angry, and you will see this through the actions that they exhibit. They will say, I am stressed, but they will struggle with some intricate emotions such as shame and guilt, or even being vulnerable. And I usually ask, because I've had a couple of talks with men, how many can share that they feel low, or they feel things are not okay? Very few men. And even in this particular webinar today, we'll still ask the same question. Are you able to open up to someone else and say that today I'm not okay? The other thing that challenges men is the fear of judgment. Once a man expresses his emotions, he ends up feeling very unsafe. Have I shared too much? Have I exposed myself so much to others? So the moment they fear to being judged, then we go back to the stereotype of masculinity that if I don't share so much, if I don't share about my emotions, then I'm tough, or I'm not being considered as a man that is able to hold things together. So, Linus, you've asked me, how then do we help men in this particular aspect? Number one, we need to allow men to expand their emotional vocabulary. And when we look at emotional vocabulary, as our female counterparts will constantly have a lot to share about how they are feeling and even the intensity of that particular feeling. So even for a man, it is important for us to be able to expand on our emotional vocabulary. And there is a tool or a pictorial that usually helps, the emotional wheel or a checklist of your emotions. So I will encourage men here to be able to look at that particular wheel and be able to identify the emotion and even the extent or the intensity of the same. Another thing that will encourage expansion of vocabulary is we encourage men to journal. At the end of the day, what am I thinking? What am I feeling? What has caused these feelings and these particular thoughts? Because we are the ones who are experiencing it. And the moment we know what is causing it, then we'll be able to express it and even verbalize. Number two, we also need to normalize conversations surrounding our mental wellness and even our vulnerability. And one thing that I've come to discover or learn is that our vulnerability as men is our strength. And as Dr. Chibanzi and Dr. Nyamyobo have clearly put it, the moment you become vulnerable, you are strengthening your mental health. Because now these small pressures or these small stresses won't sit in for quite a long time. You are able to express it out and you are able to move on. The other thing is to practice emotional awareness. Awareness. When you are aware of what you are going through, then chances are you'll be able to know this one is an issue that as a man or as a boy, I'm not able to tackle. Can I reach out to another person to really assist me? The other thing that will assist is linking an emotion to an action, because men are goal-oriented. We need to teach men how to attach the emotion to an action. For example, you are in a team of colleagues, so you want to attach maybe your stress. You tell them that if I'm stressed, I'm not able to work or I'm not able to deliver. So when you attach an emotion to an action, then the other parties are able to assist to know how to help you. Another thing that will help us in being emotionally literate is having culturally relevant training like storytelling. And I'm looking at it from this angle. If men, we had opportunities to storytell with our sons, and when you're telling these particular stories, you express the emotion or this range of emotions practically to your son. So they'll be able to see your level of vulnerability. And when you're telling them that it is okay to be vulnerable, it is okay to express your emotions. So when we are looking at from at perspective, we need to have culturally relevant training in terms of expressing our emotions, so that we debunk the stereotypes that a man should not. The other thing is on mentorship, and mentorship plays a very key role in terms of allowing the boy child and the men to express. And mentorship is not only for the young boys, it goes across the board, even for the elderly. If we are able to share, and if you see maybe your mentor is able to exhibit this range of emotions, it is important even for the younger men to be able to express without feeling so much less of a man. Because if the older person is able to, and these are maybe the custodians of culture, and they are able to express the emotion in their full range, then even the younger generation will be able to pick that this is something which is normal. This is something that I, as a young person, am able to express without being judged, without looking as a lesser man. Back to you, Linus.
Thank you very much for a very comprehensive response, Mr. Patrick. But just maybe for 30 seconds, I'd like to ask a follow-up question. You mentioned a very difficult word. I've looked it up. I've never really heard of it. You said the word alexithymia, which basically means that men have got an inability to recognize and express their own emotions. It's a neuropsychological phenomenon that is actually characterized by significant challenges in recognizing and sourcing for emotions and emotional response. Since I think your response has been mainly nurture, that men have been wired to be stoic and to be less expressional. By introducing the concept alexithymia, are you also admitting to the fact that men may have come out of the box differently compared to women? That just maybe men are wired differently. That men come out of the box, if you'd like, allow me to use that word, with maybe an emotional disadvantage. Is that what you're saying?
Linus, I will say it's more of a social construction, because from a very tender age, we are socialized in this particular way. Like, a boy should not cry. You get hurt, you should not cry. And I'm giving this from a very practical experience, from my own experience, and I've seen it even in my own son. Personally, nikiwa mgonjwa, it is very hard for me to go to hospital, because I've not seen my dad wake up in the morning and go to hospital, but you see him struggle. So he's constantly struggling until it is very late. It's when he goes to hospital. Like, there's a time that he was taking my mom to hospital, and I was there. Guess what happens? So he checks himself, maybe for blood pressure. Then he's told, mzee, umekuja na nani? So you can imagine, he's taking my mom to hospital, but now the medics are worried about his own health. The same happens to me. It's very hard for me to go to hospital. Now, I've seen it even in my son, because very rarely will I tell my son that I'm going to hospital. My son currently, when you tell him you are going to hospital, the next thing, he's 4 years old, the next thing that he will tell you, niko sawa. Yet you see this particular boy is really, really struggling. So we didn't come out of the box not wired to express. We learned either through observation or even through experience. So as we talk about expressing, let us rewire ourselves back to the natural way that God created us. Thank you, Linus.
Thank you very much, Patrick. So for you, it's more nurture than nature. Thank you for a very comprehensive response. Allow me to turn my attention to Dr. Joseph with another question. Dr. Joseph, many men grow up internalizing emotional silence, just as Patrick has highlighted. How does this shape their identity and relationships later in life? In their relationships, when they maybe get attached to a significant partner, or just later in life as they become or as they grow up into adults? Over to you, Dr. Joseph.
Yeah, thank you very much, Linus. I think this is a 2-point question where you ask how it will affect our identity, number one, and how it will affect our relationships, that's number two. When it comes to thinking about impacting our identity, number one, I think this culture of feeling like we as men are stoic and we are unable to show any emotional selves that we have. It affects our identity by in two ways. Maybe number one, it would narrow our acceptability of ourselves. So we have been heavily externalized as in our identity to mean that mostly we anchor our performance metrics in things that are measurable, like maybe our achievement, our status, our ability to provide and things like that, rather than our internal emotional reality. So we end up to believe that our value lies in what we do and not how we feel or how we are. When it comes to that acceptable self, it also affects us in a way that we feel like we need to be self-reliant and we always need to be in constant emotional control so that any natural feelings, as Patrick has said, of inadequacy or grief may be experienced as an existential stress to our identity. So this also makes us hide our vulnerabilities actively. So the second way in which it affects our identity is when we are in our clinics, we see atypical presentations of psychological distress. So someone presents with anger and irritability as a defense mechanism for maybe underlying sadness, anxiety, or helplessness. So you find that people present, us as men present with symptoms of anger as a manifestation of depression. We also present with substance use or addiction as a maladaptive coping mechanism or self-medication in attempt to numb our repressed emotions. We also present with increased risk-taking or aggression as acting out to the internal pressures that we have. We also may present with somatic complaints such as emotional, which is due to maybe unresolved emotional tension. So those are also ways that we have noticed that our identity affects us. So we end up being misdiagnosed or underdiagnosed due to our change in identity growing up all the way to later in life. When it comes to the second part of the question, when how it impacts our relationships, number one, it affects our relationships by probably eroding our emotional intimacy. So we know that relationships require mutual vulnerability. And when we consistently withhold our emotions as men, there is an invisible wall that forms. So our partners may interpret silence as emotional absence or indifference, and not as stoicism as we might think or interpret it ourselves. Also, silence often triggers a dysfunctional cycle, and a cycle starts with the partner may need to feel connected and may need some communication, but we may perceive this communication as criticism or threats. And in response, we withdraw into further silence, and then the cycle continues, hence reinforcing that distance. So the other way that it affects our relationship is that it impairs coordination and support. So emotional burden on our partners happens a lot, and our partners may be forced into the role of the primary emotional processor and regulator. So this may constantly try to, our partners may constantly try to decode our silence or guess our needs. So this may lead to emotional exhaustion on the part of our partners. Also, in some instances, our stoicism is unintentionally supported by our partners who learn to suppress their own emotions and needs for connection to maintain peace. This may lead to an unequal and an ultimately unsatisfying relationship dynamic. So I think that is the way in which it affects our individual self and our relationships when we grow up as men.
Thank you very much, Dr. Joseph. Also, maybe another follow-up question for you. You might be aware that in the third edition of the diagnostic manual, we had a provision for a diagnosis known as gender identity disorder, and we changed that to gender dysphoria, partly because the diagnosis was pathologizing normal, what now is considered to be normal, which is having an identity that might not match your physical identity, or a sexual identity that does not match your physical identity. So, in the way that you said that oftentimes depression may manifest differently in men. For example, depression may manifest in the form of anger. Men tend to resort to maladaptive coping mechanisms like substance abuse. And they tend to also show aggression when they're pressurized, or somatic symptoms when they're having psychological tension. Do you think that in the way that we change the way that we view gender identity disorder, we should also change the way that we view men's mental health? And how can we avoid pathologizing maybe men's inclinations that sometimes may actually be normal?
Yeah, I think we may need to change how we perceive men's mental health. And I think we are coming a long way because maybe 10, 15 years ago, our seniors will tell us that we never had discussions around men and around men's mental health because maybe in evolutionary medicine and in evolutionary biology, men were the providers and they were not supposed to show any emotions. But as we move into modernization, we notice that the role of the man is moving away from that of a provider to that of a co-provider. To mean that women are also getting into providing in families, and we need to also start thinking of ways to also provide emotionally to our families, and that's why we need to change how we think about it. Luckily, we are helping ourselves by having these conversations. We're having a lot of men's mental health meetings and awareness campaigns. And that is helping us see a lot of men being admitted to our facilities. We're seeing a lot of men coming in for psychological support before they need to get admitted. And I think we need to, but we are on the right track as we speak right now.
Yes, thank you. Thank you very much, Dr. Joseph. I asked this question specifically because of, I'm sure that you're all aware of the term toxic masculinity. Toxic masculinity has been used to describe men's behaviors and attitudes that prevent them from seeking help, like stoicism and self-reliance. Rightly so. But over the recent years, the term has actually expanded to even cover aspects of masculinity that should actually be considered to be positive, like men's desire to seek success or to be competent or to be competitive. The term has expanded to even cover such terms or such aspects of masculinity that I think, in my opinion, should be considered healthy, and we should avoid pathologizing them. So thank you very much, Dr. Joseph. Over to you, Dr. Chibanzi, with the next question. In um, in in Kenya's and Africa in general, cultural context, what societal norms around masculinity have the biggest impact on men's well-being, willingness to seek help? Again, I'll repeat the question. In Kenya and Africa's cultural contexts, what societal norms around masculinity have the biggest impact on men's willingness to seek help?
Yeah, thank you for the question. I think to start off, I'd like to quote, I think it's a quote that you might have heard that says, "Boys don't cry and men do not shed tears." This quote is attributed to a journal publication by Goody in 1997 in the British Journal of Criminology. And essentially, it promotes the masculine health culture. The masculine health culture is a common culture in Kenya and in African countries, and it borders on certain aspects. The first one is emotional stoicism, or rather, the suppression of vulnerability. The second is the primary provider responsibility for men, and the third is the stigmatization of weakness when you seek help. So the culture rather promotes a sense where if a man seeks help, it's more feminine, it's not masculine. And this is important. So on the emotional stoicism and the suppression of vulnerability, is that, right, as Patrick earlier said, boys are raised from a young age that, you're a boy, you should be tough, you should suppress your emotions. If you're feeling sad, if you're feeling fear or anxious, you're told you're a boy. Why are you scared? Boys are not scared. And this now programs the boy to become into a man who believes that. So it's emotional toughness. Now, what this leads to is that this stoicism leads to what we call restrictive emotionality, where one is unable to express their feelings or have difficulty in finding words to express their emotional status due to fear of being judged and stigmatized. And picture that, and you realize that becomes a barrier when it comes to seeking help. because internally you have struggles as a man, but it makes you have difficulty in acknowledging the struggle. And even when you do acknowledge that you're struggling mentally, it's very difficult for you to seek help. I'll give a scenario, and maybe you can just think about it. If a man sat somewhere in town and just broke down and cried, and if a woman sat down in town and broke down and cried, what is the likely response for both of these two? Just think about that. And that is where part of the issue that we have is that this culture promotes a sense of I'd rather die in silence rather than appear vulnerable for men. And it's a key barrier to seeking help. Provide and protect a role. So our identity and social status as men is heavily tied to our ability to be a primary breadwinner, to control the family, provide for the household, and factors that might hinder this then become a problem. For instance, illness, which mental illness, depression, anxiety, suicide, and suicide in men is a very, I'd say it's, for me, I look at it that the fact that more men are likely to die by suicide when they attempt than women shows you that it's a significant thing. So a man will struggle, for instance, with suicidal ideation and not talk to anyone because they're trying to appear strong and trying to be a because they know they're ingrained to be a provider and a protector. So even when they're going through difficult times and they have mental distress, they're unlikely to even talk about this with someone. And eventually you realize that they just attempt, and when they do attempt, a good number of them actually take their lives. And so we are all left wondering what was happening. He never showed any signs that he was going through difficulty. He was always there. He provided. He was always smiling. So it becomes a complete irony of what the person was going through and what he presented. The other societal norm has been already alluded to, but I think I'll still expand on it, is the stigma and fear of of appearing weak. And it's actually a significant barrier because it promotes a pervasive belief that when you seek any form of help, medical, financial, or psychological, it's a sign of weakness or an admission of failure. So in our communities, in our country, is that this promotes the stigma of seeking help. And if you go through the cultural context, is that what is reinforced normally is the teachings and rites of passage should be more of, you should be strong, you should have self-reliance. For instance, I'll use the circumcision that happens in some of the communities in Kenya where the boys go through the circumcision rituals and they're expected to not cry when they're being circumcised. You can imagine despite the pain that one has to go through, how much that promotes this culture of that you should not show weakness, you should not appear weak. Now, what are the consequences in regards to what you asked in terms of seeking help? Is that what the first is that it leads to delayed care. So by the time a man comes to you seeking help and talk on mental health, by the time you see a man coming to you and opening up about what they're struggling with, the most common thing you'll find is that they had already adopted a maladaptive coping mechanism. So you'd find that they'd resort to substance use, alcohol, smoking. So they come to you not because of the primary issue that they were dealing with that was causing the mental distress, but they come to you because at some point they're financially ruined. They can no longer sustain their maladaptive coping mechanism, which is substance use. And so now they feel like, okay, fine. Now where I am, I'm at the end, I don't know what to do. So they start telling you about the substance use. They start telling you about the issue that they were going through that eventually led to their substance use. That's a very difficult thing for men. And from my experience, the male patients I've dealt with, I normally just take time and listen and take time, and I tell them, yes, I do understand, because I know by the time they're coming to you, they've really struggled in their head for them to finally say, let me go see a psychologist, let me go see a psychiatrist to just seek help, and maybe I might get treated. The other thing is that there's reluctance to discuss sensitive issues as a result of all these societal norms. So it's very difficult for men to sit and start discussing their intimate matters. I remember during the Father's Day webinar, a story of told of how a group of 6 men went out, sat from 10 p.m., drank, were having their social drinks. And by the time the first man is opening up, it's 4 a.m. in the morning, 6 hours later, and saying, by the way, guys, I'm going through a divorce. And that now opened up a flood where 2 other people in the same were going through that. So you see, for us as men, we tend to not discuss these sensitive issues because we feel that it's a sign of weakness. It's not manly to talk about your issues. And these are now the significant societal norms in our country that contribute to poor help-seeking behavior. Thank you.
Thank you very much, Dr. Chibanzi, for your wonderful response. You mentioned something along the lines of male suicidality, and I was hoping I could also ask you a follow-up question. You rightly mentioned that men are actually about 3 times as likely to die by suicide as women. Men are about 50% of the population, but 85% of all suicide cases are men. The leading cause of death for middle-aged men, this is men between the ages of 40 and 60, is suicide. Middle-aged men are actually much more likely to die by their own hands than by any other means. So we're clearly looking at an epidemic. And other people call it a silent epidemic because although it's an epidemic, it doesn't really receive much attention, the attention that it actually deserves. So what do you think we could be possibly missing as a possible explanation for why we are having this silent epidemic taking away the lives of many men? For example, we're talking about stoicism as a cultural barrier. Men are wired to be stoic. But recent studies are actually showing that a significant portion of these men who do resort to suicide have actually seen a mental health care provider. So I wish I'd actually copied the link and shared. Maybe I can do that before end of the session so that people can look at this study. But a study in the UK actually found that a significant portion of men who actually resorted to dying by suicide had actually seen a mental health care provider within a space of the last 2 years. So this is me maybe just hypothesizing because the study didn't really come to conclusions. You might say that opening up is not giving men the result that is desired, or at least men who are having suicidal ideation. What could we possibly be missing? Is there something wrong with how we're doing therapy? Do men need a unique kind of an intervention, or are we missing a possible cause and that we are not discussing? What are your thoughts about this, Dr. Chibanzi?
Thank you. I think my first thought is that there's nothing wrong we're doing in terms of how we approach men's mental health, in terms of therapy, in terms of all that. But the bigger context is that mental illness first is a very, amongst the illnesses in the world, I normally say that mental illness is quite distressing and quite debilitating in the severest of forms. And picture this in a world where men have what I described earlier, this masculine health culture. They're a provider, they're a breadwinner, they're supposed to be strong. So when one is mentally ill, some of these roles are actually affected. And now the response in the society is that if the people around you get to know that you're mentally ill, the next thing you're going to face is stigma, and also this culture where, well, he's not well. He's, he normally has mental health issues. He has a mental illness, and so they're likely to be dismissed. And this plays a significant role in now I'd say killing the self-esteem and also making men feel like, well, I'm not really of any worth. And I think, and I try this with just a case that I handled, I think, a week ago, where after an intense discussion with a man, it came out that it was about the environment around them. They felt, well, what is my worth then? Because at this point, they've struggled, they've been seeking help, but they still feel like they are not valued as much. And so that point of value, I think, becomes an additional significant contributor to the underlying mental health illnesses and all the other issues that we talked about earlier.
Thank you very much, Dr. Chibanzi. I'm being informed that Dr. Mutiso has had difficulty joining us. So for those who maybe joined the conversation, specifically hoping to hear from Dr. Mutiso, we apologize if you might not be able to do that. Hopefully he'll join us. But we still have very able panelists who handle this topic and the questions that are still left. I'd also like to remind you, for anybody who may have questions, feel free to type a question on the chat box and we'll be sure to respond to it before the end of the session. So let me circle back to Patrick with a second question. In your experience, what do you think are the common emotional challenges that are unique to men, that men silently carry? And how can counseling and psychotherapy help address these specific challenges that men face? Patrick?
Thank you, Linus, for that question. Like the challenges that men face on a day-to-day, I will talk about three. The first one being burnout. So men constantly want to push themselves to the maximum limit, not knowing when to stop. So you'll find a man constantly pushing. They're tired. Their body is already telling them that it is time to stop. But what do? They push harder. And as Dr. Chibanzi has said, we are wired to be providers, or the society says that a man should be a provider. So the moment you feel you're not able to provide, you feel like you are less of a man. So you will work yourself out to a point of breaking down without even knowing. At times, we break down even without knowing. So the first thing that men go through is burnout. And you will find when they are experiencing burnout, at times you'll find them zoning out and even losing interest in some activities that they once loved. So that's very key, that we need to understand our limits as men. The other thing that comes to mind when we are talking about burnout, they don't want to be termed as lazy. So they will constantly push, even if they know the end is not in sight, they will constantly push. So to avoid being termed as lazy, the man will push, and in turn, they will get so much burnt out. The other issue that men face is isolation. As men, we lack confidence or people that we trust to help us with our issues. So you will find men just talking about surface issues. As Dr. Chimbanzi has told us about these men that were seated somewhere until 4 a.m. is when someone is trying to open up. And in that group of men, kumbe, they were all struggling. So we lack confidence because we fear being judged. So we'll enter into our own cocoons so that we go to seek help when it is too late. Like these men, they were now talking about their issues at 4 in the morning. So the lack of confidence and just being surface is going to make men so much isolated. And when we're talking about isolation, as Dr. Chibanzi has clearly put it, the more you isolate, the more the issue gets deeper. That's why you'll find more men struggle with depression and even suicidality. So I will encourage the men here to form some social support networks that will be able to speak to their issue. There's a concept that we were sharing with one of the psychologists that I know in the course, that men constantly have this kind of conversation, shoulder to shoulder. They don't really get to see the emotions being expressed by this other man. So as compared to our female counterparts, it is important for us to have more of a face-to-face kind of conversations. The other issue that comes with men, what men face as a challenge is emotional numbness as a defense mechanism. Men will constantly suppress their emotions and even their vulnerability. So for a man to say that I need help, trust you me, it's an uphill task even for them. And when they can't numb it anymore, they will now express it either aggressively or through other channels like substance use. So by the time they are coming to a clinician, it is more compounded issues as compared to the initial issue that they could have been having. So Linus, you asked about how can therapy help? So therapy will be able to help a man name and validate his emotions, because by the time I'm able to name what I'm feeling, and I'm able also to validate that this is an emotion that I'm feeling, it is not out of the blues. So it is human to feel this particular emotion. So therapy will be able to assist the men to be able to name the emotion and validate based on the circumstance that they are going through. Number two, therapy will help break the isolation. So by the time a man is coming to a therapy room, then know that this man has reached the end of the tether. So they come in to break that particular isolation, because at least someone else is able to know that I'm struggling. And based on our therapy follow-up kind of circumstance or situation, this man will feel like there is someone who understands, there is someone who is able to journey with me. I need not to die alone. So therapy helps to break that kind of isolation that men have. The other thing that therapy helps is help with stress and burnout management, because in therapy you will be told it is time for you to take a break. And when we look at even the international labor laws, everyone is entitled to leave. Everyone is entitled to take some rest. You are not a machine that works without even service. Even machines require that particular time to just to decompress and to get service so that they are able to work longer. So therapy helps men to be able to work on their stressful circumstances and also reduce on burnout. So during therapy, we are able to get very practical ways of dealing with stress and even burnout. The other thing that therapy will help is challenging negative masculinity. So you are called to task, or your eyes is open when you're allowing yourself to be stereotyped, or you're having negative masculinity. So therapy will allow you as a man to become vulnerable. It allows you to share even the deepest thing that even at times you might not share with your partner. So therapy, being a safe space, will be able to allow you to talk to that deep issue that you have without being judged. So I will really encourage for men, before it gets to a point you now are seeking help because maybe a secondary issue is the one that takes you to the doctor. Can we normalize going for therapy when things are good, and even when things are tough. Back to you, Linus.
Thank you very much, Patrick, for especially for emphasizing on the importance of therapy. And allow me to also quote you for your response for the first question, for the very first question I actually asked you. You mentioned that we should teach men to attach emotions to an action, and that if correct me if I'm wrong, but I think you mentioned this to explain that men are more action oriented or solution oriented. Is that correct, Patrick? That we should teach men to attach emotions to actions because men are more solution oriented or action oriented?
Yes, Linus. That's what I said. So the moment we attach uh, an emotion to a task, then it's easier for us even to seek help.
Okay, so my question in regards to that, in your own practice as a counseling psychologist or a hospital psychologist, Chiromo Hospital Group, have you found yourself using a different approach with men? Do you, because I hear it, this allow in mental health circles that the way that the mental health industry is designed might not work very well for so many men. I'll just give you an example. Nowadays, we emphasize a lot on validating feelings and validating emotions. And sometimes you try to do that in session with a man, and they might actually even tell you that I would prefer that we actually focus on the problem and try to find a solution for the problem together rather than uh, talking about feelings and emotions and validating them. So have you found that maybe men are more responsive to a different kind of approach compared to women? I'm asking this because you also see women in therapy.
All right. Thank you, Linus, for that question. So men are more goal-oriented. When they come to therapy, they want solutions. And based on our ethics, we are not solution providers as therapists. So my approach to them is more of allowing them to get inward, to reflect, self-reflect. And the more they self-reflect, they're able to catch that emotion that they are struggling with. And then they are able now to attach it. If this is what I'm struggling with, now that is the task. Then if I just twitch it a bit, I'll be okay. So more of allowing them to see the emotion by just probing them to talk about what they are feeling, maybe attached to a task. For example, if a man comes to therapy because maybe he's been absent from work, already you see now the absenteeism is now causing distress. So again, working with that particular task of being absent, you talk to them and allow them to express what does absenteeism mean to you. So they are able now to see, okay, if I'm absent to work, it is going to cause me a lot of anxiety. And based on what culture says that a man should provide, then this particular man will now introspect and find out, why am I being absent? So just allowing them to talk, they'll be able to see the emotion and even validate their own emotion. So again, we don't give them solution, we just allow them to see and validate their own emotion. Thank you, Linus.
Yes, indeed, therapy is not meant for giving advice or giving people solutions, but helping them find solutions within themselves because we believe that people have the potential and they've just lost it or they don't have it at that particular moment. Thank you very much, Patrick, for the wonderful response and especially also for emphasizing on the point of isolation as a major problem that men are facing. As you might know, I also working with the corporate wellness department. I do a lot of talks with men. Just yesterday, I was at a men's meeting where I asked about 100 men sitting in the audience, how many of you can name one best friend or a person that you call your best friend and a person that knows that you're actually the best friend? None of them raised their hand. I've been in situations where half of the audience was male, half of the audience was female, and I asked men and women the same questions, and it's the difference is day and night. Women raise their hands, almost all of them. Men don't raise their hands. So another silent problem that is really affecting men is that men are turning away from relationship with other men, but also studies are showing that men are also turning away from relationships with women, and that's very concerning when we know that the single most predictive factor for happiness in life is the number of deep, meaningful connections that you have. meaningful connections predict happiness better than even the amount of money that you have in your pocket. So thank you very much. Let me turn my attention to Dr. Joseph for your second question. How do you think men can begin unlearning emotional suppression and build healthier habits of self-awareness, communication, and vulnerability? I'll repeat the question. How can men begin unlearning emotional suppression and build healthier habits of self-awareness, communication, and vulnerability?
Yeah, I think the way to do it is in two ways. First, to know yourself, and secondly, to understand how you can explain yourself to the public. When it comes to knowing yourself, you might need to be involved more and more in taking care of yourself. That is self-care. Being involved in exercise, doing things like journaling, doing more mindfulness activities, accepting your emotions, and building self-compassion. When it comes to public vulnerability, that is now getting to express yourself to the world, you might need to also come to a way to come up with safe spaces, which means this is not a competition between men and women, but women have a lot of what we call charmers, quote unquote, where they are able to sit, despite it being an economic gathering, they still have social discussions that they have. So we might need to also borrow a lift from women by doing that more. We may need to borrow a lot from women by being open to coming to seek psychological and psychiatric support. We might need to be more open by, as we have discussed earlier, looking for a community, looking for a tribe, looking for a support group. It could be maybe a football club where you go and play football. It could be maybe a place where you hang out with your friends and drink some tea. Also, we might need to be very open to our partners, so that we need to, as much as they are communicating their emotions, we also might need to be also more out there and proactive in communicating our emotions and not keeping them as a form of physical symptomatology. Thank you.
Thank you, Dr. Joseph. You've said that rightly so. Men need to look for community and many other very important and impactful points. Allow me to go to the next question. Dr. Chibanzi, I'm calling you to attention. What systemic issues or structural barriers in healthcare, families, schools, or workplace that most prevent young men from accessing mental health support, and what are workable solutions? What systemic or structural barriers most prevent young men from accessing mental health support, and what do you think, in your opinion, are the workable solutions?
Yeah, thank you for that question. It's a two-point question. The first thing is to address the barriers, and the second is to highlight the solutions. Now, systemic and structural barriers, I think we've already alluded to some of them in terms of cultural, societal norms, the traditional masculine culture that teaches men to be strong and emotional, self-reliant, talked about emotional stoicism and restrictive emotionality. All these are barriers to men seeking healthcare, mental health, not just mental health, but just basically just seeking help when it comes to their health. Now, in terms of the healthcare system, because you talked about healthcare systems, schools, workplaces, and family. On the healthcare system, there are certain barriers that are very, very glaring. And I think the first one is we have a shortage of specialized, and I'll talk about mental health, specialized mental health professionals. There is a perception also, in addition to that, that has feminized mental health services. It's a perception. I said it's a perception from studies and from commentaries. And this is because the opening up, the culture of psychiatry is where you come, mental health, you come, open up, you seek help, and then you go through therapy and you're given interventions and treatment to help you. For instance, if you look at the number of psychiatrists in Kenya and you do a gender distribution, I can confidently say up to 70 to 80% are female and maybe 20 to 30% are male. And so that already gives you that perception that even within the healthcare profession, a male psychiatrist, men will be like, why would you do psychiatry and why not do surgery where it's a matter of showing strength? And that already becomes a barrier because it leads to a shortage of personnel, and there's this seeking healthcare around the gender component, and that's a significant barrier. I'll talk about the solution. And then the other thing is the family structure. That becomes a structural barrier. Family beliefs and communication styles that play a very crucial role in this. For instance, in some families, it's taboo to speak about a mental illness. More likely, parents and relatives will deny that it's a mental health problem. They'll talk of all other issues, traditional issues, and attribute it to any other thing, substance use, but not mental illness. And this I've seen being a significant barrier in actually treating some patients, because the family and the relatives have shut off completely. It's not mental illness. They don't even want to talk about it. So treat him or her, but don't tell us it's mental illness, or don't let other people know. And of course, you don't disclose, but then they also feel like if it's known that this person is mentally ill, then it's a very big problem for them as a family. And these are barriers that are very significant. The other one is generational divides within families, especially for the younger men and between younger men and the older men in the families, where the older men will feel like we went through these things, we were able to survive somehow, but this is a different generation of younger men that perhaps need a more supportive family environment. Now, in schools, the first thing is inadequate mental health literacy within the curriculum. And I think this is also quite significant. The solution to it is where we need to amplify mental health education among schools and workplaces. Lastly, where you talked about workplaces, the barrier here is there's lack of robust mental health policies within the workplace. I think in the last 5 years, we've had significant improvement in our country in terms of rolling out of workplace mental health policies that are supposed to be adopted across all workplaces in Kenya. And this leads to an instance where young men or men feel they'll be judged, it will harm their career prospects, it will damage their reputation, and even lead to job losses. And it's this point for me of workplaces and being unsupportive is one that is I had a very recent case of a male who felt that their workplace was no longer supportive and they wanted a completely different environment from the current workplace because of them opening up, and then now the ridicule that came and all that. And it's quite significant. So the solutions, we need to promote mental health literacy and destigmatize through public awareness campaigns, through having these conversations and making them normal. We need to integrate mental health education into the school curricula at a very early age. We need to train providers, all of us, male and female, on gender-sensitive care. This is very important because then now it slightly aligns your care differently when you realize, okay, I'm dealing with this gender and this gender, so that you're able to help more and actually get the confidence of your patients. Now, we also need targeted tailored interventions that include promoting mental health and wellness in a different language and imagery, especially for the men. We just trying to, for instance, say it's mental fitness rather than saying mental health. Men are more like, because the fitness would pass a message that, okay, it's problem solving, it's trying to reframe how you seek help, and also to control the narrative and also have a proactive choice. Then the last two is to foster supportive environments in institutions. So our workplace mental health policies should be very clear, and managers need to be trained so that they can support you. So what we call gatekeepers, that is teachers, managers, family members, to support non-judgmental and proactive environments that allow men to seek help and be able to get adequate help. Then the last is we need to also think slightly out of the box and vary the support options. There are those who would like to seek help anonymously, so we can create platforms, online or digital platforms and digital interventions that would give them that space to anonymously seek help before they can now come out and seek help with them being seen or being known. I think that answers the question. Thank you.
Thank you very much, Dr. Chibanzi. As I was thinking, I was preparing for this conversation yesterday. I couldn't help but think of a famous quote by a lady called Dr. Sue Johnson, who's a relationship expert and the propounder of emotional focus therapy. She said, and I quote, "To be the very best you can be is really only possible when you're deeply connected to another. Splendid isolation is for planets and not for people." And I was thinking about that quote. I was wondering to myself, how much of men's mental health is also dependent on men having a good relationship with women? And this was not part of the questions that we prepared for today, but I'd like to ask maybe one of you, whoever can volunteer, do you think that men's mental health also depends on us, men specifically, having good, stable relationships with the opposite gender who also represent 50% of the population? Because I feel like sometimes when people talk about women's mental health, men's mental health is oftentimes at the exclusion of the other side of the argument, which I think is also absolutely crucial. So yes, anyone, Dr. Joseph, Mr. Patrick, Dr. Chibanzi, to what do you believe that in order for men to experience good, positive mental health, uh, we also need to orient ourselves in a way that we have good relationships with women?
Yeah, the answer is yes. And
Yes.
probably does not need to explain why. But for us to have good mental health, we need to be in a good state of relationships with people around us, including women.
No, thank you. Thank you very much for that, Dr. Joe.
For me, I'd say yes, because at the end of the day, the net effect of good social relationships, even including the women, is that it creates a social connectedness environment, which is very critical for one's mental health and well-being.
Thank you very much, Dr. Chibanzi. Patrick, would you summarize it for all of us?
I will also say yes, because we need them for that emotional nurturing, because they are more natural nurturers. So once we are able to interact with them, we are able even now to express our emotions. Because there's a question being asked by Agnes, that why is it that men open up to women than their fellow counterparts? So it's about perception that women are more emotionally supportive. So is it a perception? Yes, it's a perception, but also a reality. They are emotionally supportive. So when we are able to share with our partners about our deep emotions, then it becomes even a plus for our mental health. Thank you.
Thank you, Patrick, and thank you actually also for introducing the next segment of the conversation, which is Q&A. For those who are wondering, why have we gone beyond the 9:30 a.m. allocation for the bi-weekly grand rounds? We were given a much more generous time allocation, also to commemorate International Mental Health Awareness Month and Men's Day, which happened yesterday. So for the rest of our time allocation, we'll address the questions and then I'll hand the session back to Pendo, who will summarize it all for us and introduce Professor Jenga to wrap it up for us. So there's some questions that I'd like us to address. First, one Patrick has already responded to. The next one I'd like us to address is, what are the practical coping strategies I can use instead of just talking about it? Are there other practical coping strategies that men can use instead of just talking about it? I hear this question a lot actually from men because of men's different preferences. So what do you suggest, Dr. Joseph?
Yeah, I think there are a lot of coping strategies that we can evolve as men, and we have discussed them. I think Dr. Machonda, myself, Patrick have brought them up. Number one is the importance of exercise and self-care and physical activity in your life. That's a very important coping strategy for men, especially because we are naturally or by nature very competitive. Number two is the importance of just self-compassion, allowing yourself to accept that you feel the way you feel and that you can also have losses. The other one is also the importance of coming to us as your healthcare providers and talking to us and not just talking to any just unprofessional person who also is a very important strategy as they have asked in the question.
Thank you very much, Dr. Joseph. This next question was also for you because I think you're best poised or positioned to answer it. How can I know if I'm experiencing, if what I'm experiencing is clinically concerning or clinically significant and not just stress or not just a normal emotional occurrence? Please.
Yeah, we know that life stress will always be there. So we can't be blind to the fact that everybody will have to go through stresses of life. But it will be clinically concerning or distressing if it is affecting your relationship with people around you, if it is affecting your functionality, so you are not able to work, you're not able to go to school, or if it is affecting your physical health. So maybe you are taking substances too much to a point that your physical health is struggling, or you are to a point that you are not having adequate sleep or adequate hydration or adequate nutrition.
Thank you very much, Dr. Joseph. Very well put. Dr. Chibanzi, I think this question is asked by a woman. How can I be a man's mental health ally? This is probably a woman, but I might be wrong. But what do you think somebody needs to do in order to consider themselves a men's mental health ally? Dr. Chibanzi?
Yeah. Thank you for that question. I think the first thing is that the person should, I call it, you must show empathy when you're in a position where men can actually come and talk to you. But more importantly is to be very listening and attentive and be very attentive and don't show a judgmental attitude. Just let them express themselves at that point. And secondly is to promote it out that you are actually a person who's passionate about men's mental health and that you are ready to help and foster that supportive environment and give solutions to the issues. I think that's what I'd say in regards to that. I don't know if you can allow me to answer one of the questions that I've seen that is quite interesting.
Yes, please go ahead, Doc.
Yeah. So there's one who's asked about whether there was a societal framework that directed emotional expression for men and women. I think this is shaped by the traditional role that we've always had. If you go back to the age before the industrial age, where men would be out there working in the farms and the women would stay at home to try and take care of the children. I think that's where all this identity and emotions came. That masculine culture has always been there traditionally. I don't think we've ever gotten to a point where we decided we are developing a framework for emotional expression. The other question that is quite interesting from the same person is whether men should cry the same way women do. I think crying is biologically a mechanism that is used for expression of emotions and how we react to certain situations. So both men and women are human beings, have the same, they have a similar and of course a different biology, but crying is standard for all. And I think it's allowed for men to also cry. And then lastly, what with the organization of gender roles in society, if more men became expressive emotionally the same way women are. And I think this question already attributes to the societal nature of which we've always been raised we've always had a patriarchal society. And that means that men are seen to be more strong, more dominant in the society and all that. But I don't think that if we go to a point where men are expressing their emotions and speaking about their struggles, there'll be any change in gender roles. I think it provides that opportunity for women to actually finally accept and understand that men now can express themselves, and so they need to take that role of, okay, we listen and be more supportive. Thank you.
Thank you very much, Dr. Chibanzi. For those wondering where the questions are coming from, we also have people joining in from other platforms. So some of the questions that I've asked you might not have seen on the chat box. There's also another question that came from other sources that I think has already been addressed, but I just ask it. I just maybe mention it. Could the current style of upbringing be the contributing factor to the rising number of men who avoid responsibility, especially as many now seek wealth through shortcuts rather than hard work and discipline? I think it's been a consensus. The panelists have a consensus that it's more nurture than nature. So I think the panelists would 100% agree with that. I don't know if Pendo, or is there any question that you think we should address? Time is not on our side. We should be wrapping up. Or maybe I can ask the closing question, and with your permission, maybe Pendo? Hopefully I'm not leaving anybody out with a burning question.
Yes, Linus, we have a question that has come in on the Q&A bit, which says,
Yes.
there's been a debate lately of men missing in social places and women asking, where are the Kenyan men? Also, women have been complaining on aggression in men approaching them. How would you explain these changes?
Yeah, Patrick, I think this is Patrick is best positioned to answer this. Please, Patrick, if you can.
Okay,
There's a
thank
conversation
you.
about men missing in social places, especially clubs, and then about men approaching women aggressively. Women are complaining that they're being approached by men aggressively.
All right. Thank you, Linus, and thank you, Pendo, for that, and for the person asking that there's the debate lately that men are missing in social places, and women asking where are the Kenyan men. Also, women have been complaining in aggression in men approaching them. So to respond to this, I had mentioned earlier on that one of the challenges that men face currently is the pressure to provide. And the moment there's the pressure to provide, they are more likely to get to a position of being burnt out. So you will miss out men in social areas because the society is telling them you need to provide, you need to provide. So constantly they'll be working themselves out as compared to being in a social place. They will prefer, let me work so that I provide. And the other question that was asked about men missing out, not missing out, let me just look at it again. The issue of, no, let me just finish responding to this, then I will come back to that. So missing out on social issues, it's more of the work that they are doing to provide for their families. And the other part of the question is about the aggression. So most men, as we've seen, will easily express their emotions in a more aggressive way. So wacha nitatumia lugha ya mtaa. Mwanaume akikataliwa, it's hard for them to accept that because it's something that maybe they didn't expect at that particular moment. So they might turn out aggressive, either physically or even verbally, towards this particular lady. So how will we explain these changes? That is still the third part of the question. So in looking at the socialization, men are conquerors naturally. They feel they need to conquer. So the more they can't conquer, the more they feel they need to conquer. That's why they'll be very aggressive, even in pursuing this particular woman. And when you just listen to maybe like teenagers when they are having their stories as men, what will they be talking about? How can I conquer that girl? How can I be are the creme de la creme in terms of relationships. So as we grow older, this is already ingrained in us. So that is what will explain that if I'm not able to conquer, then I'll need to even work harder. I'll need to show myself so much stronger so that I'm able to conquer. Thank you.
Thank you. Thank you very much, Patrick. So we need to wrap up now. Thank you very much for the panelists for your wonderful contributions. But before we wrap up, I'd like to ask one more question, just a few seconds as we now wrap up the session. What one message would you want every man listening today to walk away with? Starting with Dr. Chibanzi, then Dr. Joseph, and Dr. Patrick, in that order. Dr.
For me, the message is simple, that it's okay to open up to people you trust about your struggles, and especially, and struggles could basically be just stressful situations. They could be from work. It's okay to have someone you can open up to. And more importantly, let's create as men these opportunities and these spaces. I think for what I do, I'd use an example. I normally have a group of friends who are all male, around the same age group, and some slightly older, where we weekly or every 2 weeks just go for a walk and we open up about the struggles we're facing at work and all that. And out of that, you're able to give each other some support and solutions. So I think that culture for me is important for us as men to develop.
Yeah, we need to bring back the male-only spaces that are healthy and are productive. Thank you very much, Dr. Chibanzi. Dr. Joseph.
For me, 3 points. One, accept your emotions, feel what you feel and accept it. Number two, take care of yourself in whichever way you need to, be it nutrition, be it your physical health, and be it your hydration. Number three, build a community around you, one person at a time, that will be there for you. Thank you.
Yeah, thank you very much, Dr. Joseph. Patrick?
My parting shot for today is it takes a strong man to admit his vulnerability and even a stronger man to learn from it. So let us allow ourselves to be vulnerable, create safe spaces for men so that we are able to talk about our issues. Thank you.
Thank you. Thank you very much, our lovely panelists. All of you are my seniors in this mental health industry. It's been a pleasure and a joy and an honor to lead this conversation. Thank you very much. At our peak, I think we're at around 160 participants. Now we're at 126, which is good for a day like this, at a time like this where people are busy. So, but without further ado, let me hand the session back to Pendo. Thank you very much. Until next time. Bye-bye.
Thank you so much, Linus, for taking us through this very insightful session, and also special thanks to all the panelists for their great insights. At this point, I would like to invite our chairman, Professor Frank Njenga, to give his remarks for this session today. Over to you. Professor Njenga, may you be here with us on the call? Okay. Okay. As we wait for that, I would like to, at this point, invite someone else to give us commentary on this conversation. I would like to call to and randomly pick part of the audience to respond to that bit as we wait. Dr. Bukusi, might you be here with us? Would you be able to give us a commentary on this discussion today?
Okay, is that better?
Yes, now it works.
You hear me now? Yes, you have not
yeah.
unmuted me.
Apologies for
Okay,
that.
good.
Yes.
Good stuff. I have 2 minutes. I have a few things to say, if you can hear me now. First of all, let me say that this is an excellent conversation, way past its time, but the panelists who have spoken today have done themselves and ourselves proud. The first thing I would like to say is that we must be very careful about holding this conversation in a binary manner, meaning that girls are good because they cry loudly and boys are bad because they don't cry at all. I don't think that is necessarily the binary position we want to assume. I think the reality is that both men and women have feelings, and by and large, society, human beings have survived, if you believe in Adam and Eve since then. And I think most men and women do fairly well. I think what we are talking about today are clinical populations. And the way we look at clinical populations and the way they express themselves or not express themselves, I think is very, very, very important. But I think we need to acknowledge that by and large, healthy men are healthy people and healthy women are healthy women. That I did not hear come out as loudly as I think it should be brought about. The second thing is I haven't heard the word hormones spoken. I think biologically men and women are different. And whether we like it or not, hormonally, we are designed differently and our behavioral characteristics are different. A part of the support for this hypothesis is when you look at the mental health and the ability to express themselves across the world, whether you look at American populations, Kenyan populations, British populations, all the things that have been discussed about the difficulties of men, including suicide rates, across the world are very similar. And I don't think we should bash ourselves too much as Kenyans and as Africans because it looks like biology has to be looked at. And when you look at biology in this sort of way, you must use a word that Dr. Joseph has used, is what is the biological evolutionary purpose or benefit for men being different from women. I really like the emphasis that has been placed on self-care for both men and women. Regular exercise, diet, sleep, spirituality, and crucially, particularly among the Gen Z, and this is a new study that has just been done, reduction of screen time. Because screen time, up to 6 hours is what the Gen Zs are going through. And that coupled with lack of exercise is very, very detrimental to the health of men. Finally, I am completely disappointed by all the panelists because they have not said that old men like me have any use whatsoever. I would like to suggest that any society that does not find old people useful is a society that is not making use of all its resources. It is true that the way a society is structured, younger men benefit from regular contact with older people who have had experience in one or two things. And in addition to what Dr. Machonda has said about age groups hanging out together and doing marathons, I think we need to encourage old people who don't really have too much to do anyway to offer themselves or to make themselves available for the service of younger men. Thank you so much. An excellent presentation ended by an old man who feels like he's not being made use of. Thank you very much.
Thank you so much, Chair, for those remarks. Great conversation had today. And with that, we end this session. I would like to thank everyone who was able to join this session. And I would like to also invite you in 2 weeks' time for the next edition of the Grand Round. Until then, I wish you all a good week ahead. Thank you.